Quality of space, connection to people, fresh air, greenery and daylight are always highlighted as key objectives in the visions for healthcare projects. But somehow towards the completed building it seems like it gets less and less attention, and in the end to some degree it's no longer expected. We need to reinvigorate our shared commitments to the principles of health and include a more expansive take on the patient experience, one that also takes the experience of staff into account. Patients and their relatives are related in an ecosystem of well-being. One affects the other, and it all affects the quality of care, and it all affects how we gain value out of our resources. We want to widen our perspective and see the immense opportunity to learn lessons from other typologies. Whether being a school, a museum or housing area, we always investigate how a wider approach to healthy living can impact and bring value within, but also beyond the core purpose of what we design. Research shows that learning is more efficient when it's combined with physical activities. Our design for Frederiksberg School in Aarhus in Denmark promotes learning through movement and perception. Research in healthcare tells us that avoiding isolation and also giving the patients and the relatives the agency to act has a very positive effect on stress, motivation and recovery. We see the spaces in between the clinical areas as unredeemed spaces, but combining our knowledge and wider approach on healthcare with the clinical expertise, we can unfold these areas and make them inspiring spaces that encourage to act, train, contemplate and socialize. We have the knowledge of fundamental values of good working environment. But somehow when we design healthcare spaces, the discussion comes around workflow-related issues and not what makes a good workspace. In Copenhagen, we have designed a new administration building for KAB. The objectives from the brief was kept and refined into design solutions that now promote professional development, social cohesion, collaboration and openness in a very warm, inviting and almost homely perceived atmosphere. A new attention to the working environment for healthcare staff is highly needed, and it will bring in new ideas and maybe also new ways of working in favor of the staff, but also in favor of the patients. Moesgaard Museum is a venue for a world-class prehistory and ethnographic museum, but it's also an inspiring project to how a very big, very large and complex building reaches out to the surrounding communities and becomes a popular destination way beyond what the core purpose is and the original program. Learnings from projects like Moesgaard Museum can inspire the development of healthcare spaces towards being community attractors and also ambassadors for healthy living. With knowledge, boldness and curiosity, we can verify the importance and relevance for these ambitious and visionary initiatives. Let's develop them to be the next generation of healthcare spaces.